I've been excited by the rich and diverse offerings at this conference. There is so much on different genders, sexualities and relationship diversities. Last year's European Sexology conference was surprisingly heteronormative. My presentation is about a concern that clinical sexology and sex therapy trainings present an uncritically heteronormative perspective and thereby failing to prepare practitioners for working with a range of genders, sexual practices, orientations and forms of relationships. We need to be aware of how a heteronormative lens can lead us astray and how being able to adopt other lenses can help the narrative become more three-dimensional. We need to question our beliefs about sexual health. We need to embrace diversity and prepare therapists for more than just a couple presenting for sex and relationship therapy. We need to put intersectionality at the core of our therapeutic frame of reference, as single vision lenses are not sophisticated enough to be meaningful for a large percentage of the population. Last year at the European conference there were a number of presentations devoted to measuring and treating sexual addiction and hypersexuality disorder. Presenters were seemingly oblivious to the debate about its validity, see David Lay's excellent book, and that the evidence according to the APA has failed to support this highly contested pseudo-diagnosis, which seems to have much more to do with making money for therapists from people who are in conflict with their religious and social values, and not to treating the underlying sexual guilt or perhaps more serious undiagnosed psychopathologies. We've been teaching a course for a decade offering a dozen alternative paradigms to reflecting on and working with sex addiction. My favourite clinical model to treating out-of-control sexual behaviour is a sexual health approach endorsed by ASECT that is based on 6 sexual health principles. My first time at WAS was in Glasgow in 2010, and just before my symposium, I attended a presentation given by some Belgians from the oldest sexological training in Europe, and their curriculum was also surprisingly very heteronormative. The trainings for clinical sexologists seem to be about helping cisgender heterosexuals make babies. We're basically training therapists to help people to breed. Sex therapy training doesn't focus on helping people have better sex. For example, how to deep throat a penis, how to help women masturbate, how to have energy breath orgasms, or how a skilled spanking or flogging can raise endorphins and help people reach ecstatic highs. These kinds of courses exist, but largely outside of basic sex therapy training. Raise your hands if the anatomy section of your training included the anatomy of the anus and rectum. For many people, this is a source of sexual pleasure and distress. It also means we're not teaching therapists how to treat anodyspareunia, and yet a significant number of gay men report physical pain from penetration, and many have psychological barriers to enjoying it. Of course, this doesn't only apply to gay men. People of all genders may want to try or actively enjoy anal sex, and so it's a great mystery why this is excluded from basic sex therapy training. We're neglecting to prepare sex therapists for working outside of a heterosexual dyad. Consensual non-monogamy is on the rise. The 50 Shades phenomena has seen a huge increase in people exploring BDSM, and are sex therapy trainings keeping up with this and helping people explore their kink dynamics safely? It should not be left for postgraduate trainings like ours to teach diversity and cultural competency with a wide range of different genders, sexualities and identities. Thank you.